The pipes, we talked about the chambers. The tank is what I want to focus on right now. So when you talk about blood, the blood volume is dependent on your gender and your mass, and those two factors contribute the vast majority of the determination of the amount of blood that you carry, okay? Women carry less than men by a reasonable fraction, a little more than 10% difference, and you carry less and less blood per kilogram as you get heavier and heavier, okay? Capacitance vessels are what we refer to as blood vessels that are able to distend to take on extra volume. These are things that can flatten, okay? These are primarily veins. Capacitance vessels are designed to allow us to have more fluid or less fluid in our body without immediately having to pee out any excess and without seeing circulatory collapse if we run too low, okay? Now, the blood vessels in the body follow a specific pattern. You have the aorta, which is the prime artery. The aorta then goes to the arteries. The arteries go to the arterioles. Okay, now the arterioles are extremely important. Arterioles are the primary muscular portion of the blood vessels, and they regulate the blood pressure. So when we talk about vasoconstriction, when we talk about clamping down those blood vessels, what we are affecting is primarily the arterioles. We are clamping down on that portion of the arterial circulation. The vessels that are larger than the arterioles are what we refer to as elastic arteries. Their job is to serve as a pressure reservoir, okay? Why was the crossbow an effective weapon? Why did the crossbow change warfare? You had strong men who could pull a bow and release it, right? Some of those bows that they used to use, those long bows, had 100-pound drawstrings. You ever tried drawing a 100-pound bow? I can't do it. The crossbow was different because you could take a crank and store up a bunch of energy in the crossbow, more than any man could ever draw back. And then it'd catch on a notch and you could release it all at once. The same is true of the circulatory system. The heart charges the aorta. That is the heart's primary purpose. It is to charge the aorta. So you pump up the aorta, which is a large elastic blood vessel, to a very high pressure, and the aorta is, if you are healthy, elastic. So at that point, it's like a balloon that you blew a bunch of air into. When you let that balloon go, you're going to get a steady, progressive flow of air out of that balloon. Does that make sense? If the heart had to push the blood all the way through your entire body all at once, it would have to be 10 times stronger than it actually is. What it does is it charges up the aorta, and then it allows that blood to circulate over a much longer period of time, okay? It's conservation of energy. So instead of pushing all at once, it does it over a longer period of time. Same thing as a ramp. I could either pick up a 100-pound weight and drop it on this thing, or I could slowly move a 100-pound weight up a ramp. Either one's going to accomplish the same goal, right? Conservation of energy. So once we pass the arterioles, then we are ready for the capillary network, okay? The capillary network is the primary source of gas exchange in the body, okay? All tissues need to be within 3 to 7 cells of the nearest capillary. If they're not, tissue generally cannot survive. There's a reason there's a massive gap in organism size between microcellular organisms and complex organisms with a circulatory system. It's because once you get larger than that certain critical size, you have to have some way to circulate the oxygen around, right? Now, the capillaries are an inefficient network. They have a leakage rate of 3%, and that leakage is what we refer to as lymph fluid. Okay? That's free filtered water, sometimes with microprotein, that is trapped in the interstitial tissues of the body. That has to be collected because it is constantly accumulating. That's where the lymphatic system kicks in. It picks up that extra fluid, and under the force of muscular contraction, calf muscles, thigh muscles, arm muscles, pec muscles, that fluid is passively forced back into the heart. Okay?